variants of concern cases have been reported across Canada, with the B for over 90% of these cases.
Bonjour à toutes et à tous. Aujourd'hui, nous ferons le point sur l'épidémiologie nationale et les travaux de modélisation qui informent la gestion actuelle de la COVID-19 au Canada. L'accélération de la livraison des vaccins annoncée cette semaine est une bonne nouvelle. Toutefois, l'augmentation du nombre de cas, l'évolution des tendances en matière de sévérité et la proportion croissante des cas impliquant les variants préoccupants nous rappellent que la course est très serrée entre les vaccins et les variants. Le nombre total de cas cumulés de COVID-19 dépasse maintenant 950 000. Les cas actifs sont passés à près de 39 000 et le nombre croissant de cas de variants préoccupants représente désormais une proportion élevée de nouveaux cas déclarés dans les provinces les plus touchées. À ce jour, plus de 7 100 cas de variants préoccupants ont été déclarés au Canada, le variant B117 représentant plus de 90% de ces cas.
Dr. Tam, you might be on mute.
29 deaths were reported daily, and close to 2,200 people with COVID-19 were being treated in our hospitals each day, including over 600 in critical care.
Diapositive 1. La diminution du nombre de cas quotidiens et les tendances de sévérité présentées lors de la dernière mise à jour ont malheureusement commencé à s'inverser. Le nombre de cas quotidiens a augmenté de plus de 30% au cours des 2 dernières semaines, avec une moyenne nationale de plus de 4 500 nouveaux cas déclarés quotidiennement. Le nombre de cas est élevé et en augmentation. De même, après des semaines d'activité accrue de la maladie, les indicateurs de la sévérité de la COVID-19 commencent à augmenter. En moyenne, au cours de la semaine dernière, 29 décès ont été déclarés chaque jour et près de 2200 personnes atteintes de la COVID-19 ont été traitées dans nos hôpitaux chaque jour, dont plus de 600 aux soins intensifs.
Slide 2. The time-varying effective reproduction number, or RT, represents how many people are being infected by each new case. When each new case infects less than one person, the epidemic will die out. Nationally, the RT has been greater than 1 since early March, meaning that every 100 cases in Canada passes the virus to more than 100 others, and so on, with each new generation of spread getting larger.
Diapositive 2. Le taux de reproduction effective variable dans le temps, ou RT, représente le nombre de personnes infectées par chaque nouveau cas. Lorsque chaque nouveau cas infecte moins d'une personne, l'épidémie s'éteint. Au niveau national, le RT est supérieur à 1 depuis le début du mois de mars, ce qui signifie que chaque centaine de cas au Canada transmettent le virus à plus de 100 autres personnes et ainsi de suite, chaque nouvelle génération de propagation devenant plus importante.
On slide 3, COVID-19 incidence is increasing in provinces west of the Atlantic region. Variants of concern represent an increasingly high proportion of reported COVID-19 cases, with estimates ranging from 5% to over 50% of new COVID-19 cases in these areas. This raises the risk of spread into new areas where rapid acceleration of growth can occur. Early, strong, and sustained community-based public health measures and consistent adherence to individual practices work best to slow growth, maintain low levels of activity, or eliminate transmission from an area.
Diapositive 3. L'incidence de la COVID-19 augmente dans les
COVID-19
provinces à
incidence
l'ouest
is
de la région
increasing in
atlantique.
provinces west of the
Les
Atlantic
variants
region.
préoccupants représentent une
Variants of
proportion
concern
de plus en plus
represent
élevée
an
des cas
increasingly
de
high proportion
COVID-19
of
déclarés,
reported
des
COVID-19
estimations allant
cases,
de
with
5
estimates
à
ranging
plus
from
de
5%
50 des
to
cas
over
actuels de
50%
COVID-19
of
dans
current
ces zones.
COVID-19 cases in
Cela
these
augmente le
areas.
risque de
This
propagation
raises
dans de
the risk
nouvelles
of
zones
spread
où une
into new
accélération
areas
rapide de la
where
croissance
rapid
peut se produire.
acceleration of growth can
Des
occur.
mesures de santé publique communautaire précoces,
Early,
fortes et
strong, and
durables,
sustained
ainsi que le
community-based
respect
public health
constant des
measures and
pratiques individuelles
consistent
sont
adherence
les
to
meilleurs moyens
individual
de
practices
ralentir la
work
croissance,
best to
de
slow
maintenir un
growth,
faible niveau
maintain low
d'activité
levels of
ou
activity,
d'éliminer la
or
transmission
eliminate
dans une région.
transmission from an area.
Slide 4. COVID-19 hospitalization rates are leveling off or increasing in provinces with elevated disease activity. On average, the length of stay for people hospitalized is about 2 weeks, or close to 3 weeks for those experiencing more severe illness. This means that the number of patients being treated in hospital with COVID-19 accumulates over time, placing a prolonged strain on the health system.
Diapositive 4. Les taux
Slide 4.
d'hospitalisation de la COVID-19
COVID-19
se
hospitalization
stabilisent
rates
ou augmentant dans les
are
provinces
leveling
où
off or
l'activité de la
increasing
maladie
in
est élevée.
provinces with
En
elevated
moyenne,
disease
la durée
activity.
de séjour des personnes
On average,
hospitalisées
the length of
est
stay for
d'environ
people
2 semaines
hospitalized is
ou de
about
près de
2
3
weeks
semaines pour les
or close to
personnes
3
souffrant
weeks
d'une maladie
for
plus
those
grave.
experiencing more
Cela
severe
signifie que
illness.
le nombre de patients
This means that the
COVID-19
number of
traités à
patients
l'hôpital
being treated in
s'accumule au
hospital
fil
with
du temps,
COVID-19
ce qui exerce
accumulates
une
over
pression
time,
prolongée sur
placing
le
a
système de
prolonged
santé.
strain on the health system.
Slide 5. Over a third of health regions across Canada are reporting high incidence of 100 cases or more per 100,000 population. These are the darker blue areas on the map, including both urban as well as rural and northern regions of affected provinces.
Diapositive 5.
Slide
Plus d'un
5.
tiers des régions sanitaires
Over
du
a
Canada
third of
signalent
health regions
une
across
incidence
Canada
élevée de
are
100
reporting
cas ou
high
plus pour
incidence
100
of
000
100 cases or
personnes.
more per
Les
100,000
zones en bleu
population.
foncé sur la
Darker
carte,
blue
y
areas
compris
on the
les
map,
régions urbaines,
including
ainsi
both
que les
urban
régions rurales
and
et les régions du
rural
nord des
and
provinces
northern
touchées.
regions of affected provinces.
Slide 6. The good news is that since early January, incidence rates have declined dramatically among adults aged 80 years and older who've been prioritized in the initial phases of vaccination rollout. Currently, reported COVID-19 incidence rates are highest among young adults aged 20 to 39 years of age. The not so good news is that circulation of COVID-19 in younger, more mobile and socially connected adults present an ongoing risk for spread into high-risk populations and settings and continuing transmission in the community. It is important to remember that although severe illness is less common in younger age groups, serious or prolonged illness can occur at any age, and there are emerging concerns about increased severity of the B117 variants in adults.
Diapositive 6. La
Slide
bonne nouvelle,
6.
c'est que
The
depuis le
good
début
news is
du mois
that
de
since
janvier,
early
les taux
January,
d'incidence ont
incidence
diminué de façon
rates
spectaculaire
have declined
chez les
dramatically
adultes
among
âgés de
adults
80
aged
ans
80
et
years
plus
and older
qui ont été
who've
prioritaires
been
dans les premières
prioritized
phases de
in the initial
déploiement de la
phases of
vaccination.
vaccination
Actuellement,
rollout.
les taux d'incidence de la
Currently,
COVID-19
reported
rapportés sont les
COVID-19
plus
incidence
élevés
rates are
chez
highest
les jeunes adultes
among
âgés de
young
20 à
adults
39 ans.
aged 20 to
La
39
moins
years of
bonne
age.
nouvelle est que la
The
circulation
not
de la
so good news
COVID-19
is
chez
that
des adultes
circulation of
plus jeunes,
COVID-19
plus
in
mobiles
younger,
et
more
socialement
mobile and
connectés
socially connected
présente un risque
adults
continu de
presents an
propagation
ongoing risk
dans
for
des
spread
populations
into
et des milieux à
high-risk
haut risque et de
populations and
transmission
settings
continue dans
and
la communauté.
continuing transmission in the
Il est
community.
important de se rappeler que,
It is
bien que les
important to
maladies graves
remember that
soient moins
although severe
fréquentes dans les
illness
groupes
is less
d'âge plus
common
jeunes,
in
une
younger age
maladie
groups,
grave ou prolongée
serious or
peut
prolonged
survenir à
illness
n'importe
can
quel âge.
occur at
Il
any
existe des
age, and
préoccupations
there are
émergentes
emerging
concernant
concerns
la gravité
about
accrue
the
du
increased
variant
severity
B117
of the
parmi les
B117
adultes.
variant in adults.
Slide 7. In addition to declining incidence rates in elderly adults, The benefits of the initial vaccine rollout are also being seen in high-risk settings, including fewer and smaller outbreaks in long-term care homes since January. However, in parts of Canada where variants of concern represent an increasingly high proportion of cases and are associated with a greater number of outbreaks, we need to maintain a high degree of vigilance to keep COVID-19 infections rates down as vaccine programs scale up.
Diapositive 7. Outre la baisse
Slide
des taux
7.
d'incidence chez les personnes
In
âgées,
addition
les
to the
avantages de
declining
la
incident
première
rates in
campagne
elderly
de
adults,
vaccination se font également
the
centrer dans les
benefits of the
milieux
initial
à haut
vaccine
risque,
rollout are also being seen
notamment
in
par la
high-risk
diminution
settings,
du nombre et de la taille
including
des épidémies
fewer
dans
long-term
les
care
pays janvier.
homes since January.
Cependant, dans certaines régions
However,
du
in
Canada,
certain
où
parts
les
of
variants
Canada,
préoccupants
where
représentent
variants
une
of
proportion
concern
de plus en
represent
plus
an
élevée de cas
increasingly high
et sont
proportion of
associés à un
cases
plus grand
and
nombre
are
d'épidémies,
associated with a greater
nous
number
devons
of
maintenir un
outbreaks,
haut degré
we
de
need to
vigilance
maintain a
pour
high
garder les
degree
taux
of vigilance
d'infection par la
to keep
COVID-19
COVID-19
à un bas
infection
niveau
rates
alors que les
down
programmes de
as
vaccination
vaccine
se développent.
programs scale up.
Slide 8. During the earlier stages of the pandemic from March to September of last year, the territories and most Indigenous communities were successful in their efforts to limit the introduction and further spread of COVID-19. Like many areas of Canada, the winter months presented challenges as COVID-19 continued to spread into new areas, with the rate of new cases in First Nations on-reserve populations exceeding that of the general Canadian population. Reintroduction and spread of COVID-19, including variants of concern, is an ongoing risk for all Indigenous communities. Indigenous communities in remote areas were some of the first to get vaccines, and the success of these programs with high population uptake is providing benefits that will contribute to resilience in these communities heading into the spring and summer months.
Diapositive 8. Au
Slide
cours des
8.
premières phases de la pandémie,
During the
les
earlier
territoires
stages
à
of
la
the
majorité des
pandemic, the
communautés autochtones
territories and
ont
most Indigenous
réussi à limiter
communities were
l'introduction
successful
de la
in their
propagation
efforts to
de
limit
la
the introduction
COVID-19.
and further spread of
Comme dans
COVID-19.
de nombreuses régions du Canada, les mois
Like many
d'hiver
areas
ont
of Canada,
présenté des
the
défis
winter months
car la
presented
COVID-19 a
challenges as
continué à se
COVID-19
propager
continued
dans
to
les nouvelles
spread into
régions.
new
Le taux
areas,
de nouveaux cas
with
dans
the
les
rate of new
populations des Premières
cases
Nations
in
vivant
First Nations
dans les réserves
on-reserve
dépassant celui de
populations
la population
exceeding that
canadienne
of the general
générale.
Canadian
La
population.
réintroduction et la propagation de
The
COVID-19,
reintroduction and
y
spread of
compris les
COVID-19,
variants
including
préoccupants,
variants of
constituent
concern,
un risque permanent pour
is
toutes
an
les
ongoing risk
communautés
for all
autochtones.
Indigenous
Les
communities.
communautés autochtones des
Indigenous
régions
communities
éloignées
in
ont été
remote
parmi les
areas were
premières
some
à
of the
recevoir des
first
vaccins
to
et le
get
succès de
vaccines,
ces programmes
and the
avec une
success of
forte
these programs with
participation de la
high
population
population
offre
uptake
des avantages qui
is providing benefits
contribueront à
that
la
will
résilience de ces
contribute
communautés
to
à
the
l'approche des
resilience
mois
of
de
these
printemps
communities
et d'été.
heading into the spring and summer months.
Slide 9. Indigenous communities and the territories have made good strides in increasing vaccine coverage, demonstrating strong leadership in administering vaccination programs across these communities. To date, more than 60% of adults have received at least one dose in Canada's 3 territories. Overall, more than 4.5 million doses of COVID-19 vaccines have been administered since vaccination began in mid-December, providing more than 10% of Canadian adults with at least one dose of COVID-19 vaccine. Nearly 60% of adults aged 80 years or older have received at least one dose of COVID-19 vaccine, which has contributed to reduced rates of infection in this high-risk age group.
Diapositive 9. Les communautés
Slide 9.
autochtones et les territoires ont fait de
Indigenous
grands progrès dans
communities and the
l'augmentation
territories
de la
have
couverture
made good
vaccinale,
strides
faisant
in
preuve d'un
increasing
fort
vaccination
leadership
coverage,
dans
demonstrating
l'administration des
strong
programmes de
leadership in
vaccination dans
administering
ces
vaccination
communautés.
programs
À ce jour,
across these
plus de
communities.
60%
To
des
date,
adultes
more
ont
than
reçu au moins
60%
une
of
dose dans les
adults
3
have received
territoires
at
du
least one
Canada.
dose in Canada's 3
Au total,
territories.
plus de
Overall,
4,5
more
millions
than
de doses de
4.5
vaccins
million doses
COVID-19
of
ont été
COVID-19
administrées
vaccines
depuis
have
le
been
début de la
administered since
vaccination à la
vaccination
mi-décembre,
began in
ce qui a
mid-December,
permis à plus de
providing
10%
more
des
than
adultes
10% of
canadiens
Canadian
de
adults
recevoir au moins
with
une
at
dose
least
de
one
vaccin
dose of
COVID-19. Près de
COVID-19 vaccine.
60% des adultes
Nearly
âgés de
60% of
81 ans
older
ou plus
adults aged
ont
80
reçu
years
au
or
moins une
older
dose de
have
vaccin
received at least one
COVID-19,
dose of
ce qui a
COVID-19 vaccine,
contribué à
which has
réduire les taux
contributed to
d'infection
reduced
dans ce
rates of
groupe d'âge à
infection
haut
in this
risque.
high-risk age group.
Slide 10. Based on Canadian data up to March 20th, short-term forecasting shows the predicted cases and deaths due to COVID-19 out to April 4th. The graph on the left shows the predicted number of cases could be in the range of 973,080 to 1,005,020 by April the 4th. The graph on the right shows the predicted number of deaths could be in the range of 22,875 to 23,315 by April 4th.
Diapositive 10. Les
Slide
prévisions
10.
à court terme à partir des données en date du
Based
20 mars
on Canadian
montrent les
data up
cas
to
et
March
les décès
20th,
prévus
short-term forecasting
dus à la
shows the
COVID-19
predicted cases and
jusqu'au
deaths
4
due to
avril.
COVID-19 out
Le
to April
graphique de
4th.
gauche montre
The
que
graph
le
on the
nombre de
left
cas prévus
shows the predicted
pourrait
number of
se situer
cases
entre
that could be
900
in the range of
73 080 et 1 5 020
973,080
d'ici le
to
4 avril. Le graphique de
1,005,020 by
droite
April
montre
4th.
que le
The
nombre de
graph on the
décès
right shows the
prévus pourrait
predicted
se
number of
situer entre
deaths could be in
22
the range of
875 et 23
22,875 to
315 d'ici le 4 avril.
23,315 by April 4th.
Slide 11. In the past 2 months, more contagious virus variants have appeared in all 10 provinces, with the B117 making up an increasingly high proportion of cases in provinces west of the Atlantic region. Nevertheless, more contagious variants present a risk everywhere in the country. More contagious variants like B117 can result in a rapid spike of cases where vaccines may be less effective against variants like B1351. Whereas vaccines may be less effective against variants like B1351. The Atlantic provinces have been able to sustain sufficient measures to manage importations. The Atlantic provinces have been able to sustain sufficient measures to manage importations, interrupt spreads, and maintain strong control of COVID-19. A rapid surge of cases followed the introduction of B117 virus variant in Newfoundland and Labrador. Was quickly interrupted with strong and sustained community-based measures. More recently, a rapid acceleration of incidents in one southeastern Ontario health region elevated their alert levels from green to red in just over a week. This is a caution that the virus can spread rapidly in any community, particularly when more contagious variants are involved. It also serves as a reminder of the need to maintain individual practices even where COVID-19 activity is low, and explains why health authorities must respond quickly to any increase in case numbers. Controlling infection rates is needed in heavily affected areas. Elsewhere, ongoing vigilance is necessary to monitor, screen, and rapidly respond to any rise in cases to stop a variant of concern in its track.
Diapositive 11. Au cours
Slide
des 2
11.
derniers mois, des variants
In
plus
the past 2
contagieux
months,
sont
more
apparus dans les
contagious
10
virus
provinces,
variants
le
have
variant
appeared in all 10
B117
provinces, with the
représentant une
B117
proportion de
variant
plus en
making
plus
up
élevée
an
des cas dans
increasingly
les
high
provinces
proportion of cases
situées à
in
l'ouest de la
provinces
région
west of the
atlantique.
Atlantic region.
Néanmoins, les variants plus
Nevertheless,
contagieux
more
présentent un
contagious
risque partout
variants
dans le
present a
pays.
risk everywhere
Les
in the
variants
country.
les plus
More
contagieux,
contagious
comme
variants like
B117, peuvent entraîner un
B117
pic rapide de
can
cas,
result in a
tandis que
rapid
les
spike of
vaccins peuvent
cases,
être moins efficaces
whereas
contre
vaccines
des
may be less
variants
effective
comme
against variants like
B1351. Les
B1351.
provinces de l'Atlantique ont
The
été en
Atlantic
mesure de
provinces
maintenir
have
des
been
mesures
able to
suffisantes
sustain
pour
sufficient
gérer les
measures to
importations,
manage importations,
interrompre la propagation
interrupt
et
spread,
maintenir un
and
contrôle de la
maintain strong
COVID-19.
control of
Une
COVID-19.
augmentation rapide
A
du
rapid
nombre de
surge of
cas
cases
a
followed
après l'introduction du variant B117 à Terre-Neuve et Labrador, a été rapidement interrompue grâce à des mesures communautaires fortes et durables. Plus récemment, une accélération rapide de l'incidence dans une région sanitaire du sud-est de l'Ontario a fait passer le niveau d'alerte de vert à rouge en un peu plus d'une semaine. Il s'agit d'un rappel que le virus peut se propager rapidement dans n'importe quelle communauté, en particulier lorsque des variants plus contagieux sont impliqués. Elle rappelle également la nécessité de maintenir les pratiques individuelles, même lorsque l'activité de la COVID-19 est faible, et pourquoi les autorités sanitaires doivent réagir rapidement à toute augmentation du nombre de cas. Il est nécessaire de contrôler les taux d'infection dans les zones fortement touchées. Ailleurs, une vigilance permanente est nécessaire pour surveiller, dépister et répondre rapidement à toute augmentation des cas afin d'arrêter les variants préoccupants.
Slide 12. A new longer-range forecast model that accounts for transmission dynamics of both non-variant COVID-19 and new variants of concern gives us insight into what could happen if more contagious variants continue to spread in Canada. With more contagious variants spreading, this model predicts that current community-based public health measures will be insufficient to control rapid growth and resurgence is forecast. That's the gray line. But if a combination of enhanced community-based public health measures and good adherence to individual precautions are implemented and sustained, the epidemic is forecast to plateau. That's the purple line. Adhering to individual precaution means that we all must maintain physical distancing, reduce contacts outside our household to just essential activities, continue with good hand washing practices, and wear well-constructed, well-fitting, and properly worn face masks to protect ourselves and others. For local authorities, this means maintaining or immediately implementing strong public health measures, which may include restrictions, closures, or other community-based control measures to achieve the reductions in contacts necessary to get ahead of or prevent further spread of rapidly spreading variants. We've been saying all along that if we ease measures too soon, before enough people are vaccinated, the epidemic will resurge even stronger. With increasing circulation of highly contagious variants, the threat of uncontrolled epidemic growth is significantly elevated. This is why measures must be stronger, stricter, and sustained long enough to suppress rapid epidemic growth of variants of concern.
Diapositive 12.
Slide
Le
12.
nouveau modèle de prévision à plus long terme qui tient compte de la dynamique de transmission de la COVID-19 non variée et de nouveaux variants préoccupants nous donne un aperçu de ce qui pourrait se produire si des variants plus contagieux continuent de se propager au Canada. Avec la propagation de variants plus contagieux, ce modèle prédit que les mesures actuelles de santé publique au niveau communautaire seront insuffisantes pour contrôler la croissance rapide et une résurgence est prévue. C'est la ligne grise. Mais si une combinaison de mesures de santé publique renforcées et axées sur la communauté et une bonne adhésion aux précautions individuelles sont mises en œuvre et maintenues, l'épidémie devrait atteindre un plateau. C'est la ligne mauve. Le respect des précautions individuelles signifie que nous devons tous maintenir une distance physique, réduire les contacts en dehors de notre foyer aux activités essentielles, continuer à appliquer les bonnes pratiques de lavage des mains et porter un masque facial bien construit, bien ajusté et correctement porté pour nous protéger et protéger les autres. Pour les autorités locales, cela signifie le maintien ou la mise en œuvre immédiate de mesures de santé publique strictes qui peuvent inclure des restrictions, des fermetures et d'autres mesures de contrôle communautaire afin de réduire le nombre de contacts nécessaires pour dévancer ou empêcher la propagation des variants qui se propagent rapidement. Nous disons depuis le début que
We've
si
been
nous
saying all
assouplissons les
along
mesures
that if
trop
we
tôt,
ease measures
avant
too
que
soon,
suffisamment de
before
personnes ne soient
enough people are
vaccinées,
vaccinated,
l'épidémie
the epidemic will
reprendra.
resurge even
Avec la
stronger.
circulation croissante des
With
variants
increasing
hautement
circulation of
contagieux, la
highly
menace
contagious
d'une croissance
variants, the
épidémique
threat of uncontrolled
incontrôlée est
epidemic growth
considérablement
is
élevée.
significantly
C'est
elevated.
pourquoi les mesures doivent être plus fortes,
This is why
plus
measures must be
strictes et
stronger,
maintenues
stricter, and
suffisamment
sustained
longtemps
long
pour
enough
supprimer
to
la croissance
suppress
épidémique
rapid
rapide des
epidemic
variants
growth of
préoccupants.
variants of concern.
Slide 13. The experiences of other countries demonstrate that stringent public health measures are required to control rapid epidemic growth when more contagious variants are predominating. Several European countries, including Italy, France, and Germany, are experiencing epidemic resurgence driven predominantly by the B.1.1.7 variant of concern, which accounts for an estimated over 70% of reported cases in each of these countries. In order to suppress a third wave and preserve health system capacity, Italy and France implemented new lockdown measures last week, requiring people to stay home, except for essential reasons, over the next several weeks, and Germany has extended their partial lockdown until April the 18th. Likewise, the United Kingdom has maintained stringent public health measures to allow vaccines to reach a majority of the population. They are only beginning to ease restrictions very gradually, now that over 50% of the population has received a first dose of COVID-19 vaccine.
Diapositive 13. L'expérience d'autres pays
Slide
montre
13.
que des mesures de santé
The
publique
experiences
strictes
of
sont
other countries
nécessaires pour
demonstrate that
contrôler
stringent
la
public
croissance
health
rapide
measures
des
are required
épidémies
to
lorsque les
control rapid
variants les plus
epidemic
contagieux
growth
prédominent.
when more contagious
Plusieurs
variants are
pays
predominating.
européens, dont l'Italie, la
Several
France
European
et
countries,
l'Allemagne,
including Italy,
connaissent une
France, and
résurgence
Germany,
épidémique
are
due à la
experiencing epidemic
prédominance du variant
resurgence
préoccupant
being driven
B117
by
qui
the
représente,
predominance
selon
of the
les estimations,
B.1.1.7 variant of
plus de
concern,
70%
which
des
accounts for
cas
an
de
estimated
COVID-19
over
déclarés dans
70% of
chacun de ces
reported
pays.
COVID-19 cases in each of
Afin de
these
supprimer
countries.
une troisième vague et de
In
préserver
order
la
to
capacité
suppress
du
a
système
third
de
wave and
santé,
preserve health system
l'Italie et la
capacity,
France ont mis
Italy and
en œuvre
France
la semaine
have
dernière de
implemented
nouvelles
new
mesures de
lockdown measures. They
confinement
did that last week.
exigeant que les
The
personnes
measures
restent chez elles,
require people to
sauf pour
stay
des
at home,
raisons essentielles
except
au cours des
for
prochaines
essential
semaines.
reasons over the next
L'Allemagne
several
a
weeks.
prolongé son
And Germany
confinement
has
partiel
extended its
jusqu'au
partial
18
lockdown
avril.
until April
De
18th.
même, le Royaume-Uni a
Likewise,
maintenu des
the
mesures de
United
santé publique
Kingdom has
strictes
maintained
pour permettre
stringent
aux
public
vaccins
health measures
d'atteindre la
to allow
majorité de la
vaccines to reach
population.
a majority of
Il
the
ne commence
population.
à assouplir
They
les
are only
restrictions
beginning
que,
to ease restrictions
très progressivement,
very gradually
maintenant que plus
now
de
that over
50% de la
50% of
population
the
a reçu
population
une
has
première dose de
received a
vaccin
first dose
COVID-19.
of COVID-19 vaccine.
On slide 14, a review of key indicators and local circumstances will guide jurisdictions across the country in their ongoing adjustment of public health measures. Criteria for deciding when to shift public health guidance shown here emphasizes the role that vaccines will play as a vital new tool in reducing the impact of COVID-19. If vaccine rollout proceeds as planned and vaccines work well to reduce the spread of COVID-19, we would expect the epidemic to come under control in the coming months and for the other key indicators to improve. When the COVID-19 infections rates are reduced to manageable levels, this frees up enough capacity across public health and the health system to respond to surges, with measures in place to reduce spread into high-risk populations and settings. Taken together, these are signs that a jurisdiction may be ready to gradually ease restrictions.
Diapositive 14. Un examen
Slide
des
14.
indicateurs clés et des
A review
circonstances
of key
locales
indicators and
guidera
local
les
circumstances
administrations de
will
tout le pays
guide
dans
jurisdictions
l'ajustement
across the
continu des
country
mesures de
in
santé
their
publique.
ongoing adjustment
Des
of public
critères
health measures.
permettant de décider du moment où il
Criteria
faut
for
changer les
deciding when
orientations
to
de
shift
santé publique
public health
présentées
guidance
ici
shown
souligne
here
le rôle que les vaccins joueront
emphasizes the
en
role
tant
that
que nouvel
vaccines will
outil
play
vital pour
as
réduire
a vital
l'impact
new
de la
tool in
COVID-19.
reducing the impact of
Si le
COVID-19.
déploiement des vaccins se déroule
If
comme prévu
vaccine
et
rollout
que les
proceeds as
vaccins
planned
fonctionnent bien
and
pour
vaccines
réduire la
work well
propagation de
to
la
reduce the
COVID-19,
spread of
nous nous
COVID-19,
attendons à ce que
we would
l'épidémie
expect
soit sous contrôle dans les mois à venir et que les autres indicateurs clés s'améliorent. Lorsque les taux d'infection par le COVID-19 sont ramenés à des niveaux gérables, que la capacité de la santé publique et du système de santé est suffisante pour répondre aux poussées et que des mesures sont en place pour réduire la propagation aux populations et aux milieux à haut risque, ce sont des signes qu'une juridiction peut être prête à assouplir progressivement les restrictions.
Slide 15. There are many factors that will influence when we'll be restrictive public health measures safely to gather with our families and friends and to increase social and economic activities with preventive measures in place. We will be able to lift measures sooner if we minimize the spread of variants of concern that can increase transmission, severity of illness, and reduce the effectiveness of vaccines. We maintain and adhere to public health measures to keep COVID-19 activity low, and COVID vaccines prove to be highly effective in preventing disease transmission, severe illness, and deaths, as early evidence supports. And if we rapidly increase the number of people offered the vaccine with a high level of acceptance and high uptake of COVID-19 vaccine across the population. Many of these factors are within our control. We are already seeing the benefits of vaccination in high-risk populations and need to keep this momentum going. Widespread vaccination is critical to protect you and your loved ones and to allow us to gather closer together again.
Diapositive 15. De nombreux facteurs influenceront le moment où nous pourrons lever des mesures de santé publique les plus restrictives en toute sécurité, nous réunir avec nos familles et nos amis et accroître nos activités sociales et économiques avec les mesures préventives en place. Nous serons en mesure de lever les mesures plus tôt si nous minimisons la propagation des variants préoccupants qui peuvent accroître la transmission et la sévérité de la maladie et réduire l'efficacité des vaccins. 2. Nous maintenons et respectons les mesures de santé publique pour maintenir l'activité de la COVID-19 à un faible niveau. 3. Les vaccins COVID-19 s'avèrent très efficaces pour prévenir la transmission des maladies ainsi que les maladies graves et les décès, et il y a des premières indications que cela pourrait être vrai. Et 4e, nous augmentons rapidement le nombre de personnes à qui l'on propose le vaccin et avons un niveau élevé d'acceptation de l'utilisation du vaccin COVID-19 dans la population. Plusieurs de ces facteurs sont sous notre contrôle. Nous constatons déjà les avantages de la vaccination dans les populations à haut risque et nous devons poursuivre sur cette lancée. Une vaccination généralisée est essentielle pour vous protéger et vos proches et pour nous permettre de nous rassembler à nouveau.
Slide 16. Today's review of the data and forecasts shows that COVID-19 still has a few tricks in store, and it's clear that we need to hold on together a bit stronger and longer until vaccines have us better protected. While the news of increasing disease activity and shifting trends in severe outcomes is discouraging after so many months of sacrifice, we've made significant progress, and as the warmer days approach, we'll have more options to get outside as we work through this critical leg of the COVID-19 marathon. The ramp up in vaccine supply beginning this week will accelerate vaccine programs, returning more benefits to protect more Canadians. We are closer now than ever, but it is still too soon to relax measures and too soon to gather in areas where COVID-19 is still circulating in Canada. So, as Passover, Easter, and Ramadan approach, make plans to celebrate safely, including having virtual celebrations to protect and support each other as we make this the last big push to keep the path clear for vaccines. Thank you.
Diapositive 16. Les prévisions mises à jour incluant la transmission des variants préoccupants montrent que nous devons continuer de mettre en place des mesures de santé publique rigoureuse
in
jusqu'à
place
ce qu'un
rigorous
qu'un
measures
nombre suffisant de
until
personnes
we
soient
have a
vaccinées
sufficient number
pour
of people who
alléger les
have been
restrictions en toute
vaccinated,
sécurité.
and then we'll be able
L'accélération
to
des programmes
lift
de
restrictions
vaccination
safely.
apportera plus d'avantages,
The
protégera
acceleration
plus
of
de Canadiens
vaccine
et nous
campaigns will
aidera
protect
à
more
reprendre nos
Canadians and will
précieuses
help
activités
us
sociales
to
et économiques.
begin
Nous
getting
sommes plus
together
proches
again.
du but que
We are
jamais,
closer
mais il est
to that goal
encore
than
trop tôt
ever,
pour
but it's
assouplir les
still
mesures
too
et trop
soon
tôt pour
to
se
lift
rassembler dans
restrictions,
les
and it is
zones
too
où la
soon
COVID-19
to
circule.
gather in areas
Alors, à
where
l'approche de
COVID-19 is
Pâques et
present.
de Ramadan,
So, as
prévoyez
Passover, Easter, and
célébrer en
Ramadan
toute
approach,
sécurité,
make plans to
notamment en
celebrate safely,
organisant des
including
célébrations
having
virtuelles
virtual
pour nous
celebrations
protéger
to
et nous
protect
soutenir
and
mutuellement
support each other
alors que nous faisons
as
ce
we
dernier
make
grand
this
effort
last
pour
big
garder la voie
push to
libre
keep
pour les
the path
vaccins.
clear for
Merci.
vaccines. Thank you.
Thank you, doctors. We will now open the phone line to questions. Please identify yourself and include the media outlet that you are representing. We'll be taking questions in both official languages. We ask that you limit yourself to one. Donc, nous allons prendre vos questions. Veuillez vous nommer et nous dire quel média vous
We will now take
représentez.
questions.
Nous vous
Please name
demandons de vous
yourself and
limiter
say
à
which
une
media outlet
question
you
et seulement
represent.
une
Please
question
limit yourself to
suivie.
one
Et vous pouvez
question
poser vos
and
questions dans l'une des deux langues officielles.
follow-up
Donc, nous
question
commençons avec la
in
première
either
question.
official language.
Operator, over
First
to you.
question.
Merci, thank you. S'il vous plaît, appuyez sur l'étoile 1 maintenant pour poser une question. Please press star 1 at this time if you have a question. The first question is from Marika Walsh of the Globe and Mail. Please go ahead.
Good morning, Dr. Tam. Thank you so much for taking our questions. Yesterday, the Auditor General said that the Public Health Agency essentially was using the wrong assessment tool to assess the risk of the pandemic early on, and that it was only at your own intervention that the risk level was changed from low to high in mid-March. Can you tell us when you personally first thought that the risk was high to Canadians?
Well, I think there's different ways to look at risk. So the tools that were provided, while the domestic risk at that moment in time was low, we had very few cases and they were going on outside of Canada. So I think partly is that the sort of messaging and soundbite doesn't sort of reach the full soundbite that I was providing. But at the same time, I think public health agencies, the way we look at risk, need to be more in the forecasting of the future mode, if you like, and be able to communicate that. And so, as you see in the modeling session today, is trying to do that much better than what we were, I think, and be able to illustrate not only the epidemiology as we see it now, but what could happen in those forecasting kind of models. And so we need to be the public health system writ large and globally as well as domestically need to be prediction organizations and not just being able to assess the risk of that present moment. It was not wrong. It's just that it is important to also provide what that future state might be like. And so I think as the minister has said, we take the audition of where we will go to in the future.
I'm a bit confused by your comment saying the risk assessment was not wrong. It seems to contradict what the Auditor General said yesterday, that the risk assessment was wrong. I'm just wondering, though, can you answer the question, when did you first think the risk was high for Canada?
So, as you sort of pointed out, I mean, the domestic risk at that moment in time for the cases in Canada was relatively low. So if you were in Canada during that time. Prior to that, though, we did so many things in terms of preparing, getting the lab testing, airlifting people from areas of concern and building up those sort of responses, meeting with the provinces, even from the initial
Dr. Tam,
moment.
can you just tell us when you thought it was high? But when did you think it was high?
Okay, so the risk from the outside, I think, is when you can see that the world has lost containment. I mean, obviously, it wasn't then limited to countries that are, well, China itself and where the surrounding countries. So I think certainly prior to the WHO announcement of a pandemic, we knew that essentially what the WHO said was you can't contain this thing, and there is, countries have tried, but it's impossible to contain and limit to specific geographic areas. So I think Europe, having been impacted, and we were looking at Italy and other places, that certainly makes the risk that much closer. And that sort of panned out, as in fact our importations, our greatest risk were from Europe and from the United States. And so I think around about that, so definitely prior to the WHO sort of, pronouncement, if you like, that we're in a pandemic situation, for sure, the world was looking like it was going in that sort of trajectory. And it was inevitable that a pandemic was happening.
Thank you, Dr. Tam. Operator, next question. Prochaine question.
Merci. La prochaine question est de Catherine Lévesque, La Presse canadienne. La parole est à vous.
La Presse canadienne.
Yes, hello, Dr. Tam. I wanted to follow up on that. I guess what we're trying to find out is, did you change the risk assessment after pressure from the health public officers from the provinces, or did you decide to intervene by yourself? So we're just trying to find out what the timeline is on making that decision. Thank you.
Yes, I think March, the end of February, that March timeline, and before, the WHO indicated it was a pandemic, it was pretty obvious even though the number of cases were quite low in the country, I think there were certain markers, and I would have to go back and look at the exact date. So after sort of specific travel-related cases, and we now know that the virus was coming in invisible ways in asymptomatic people. But there was one single moment in British Columbia, and I had to find a date, where we had no link. So you now have a person who was not linked to a specific travel situation, which means there was the chance of community spread beginning to happen. And at that moment, even though it was localized to one single province, we know, I think for the country, the risk needs to be shifting to portray that risk itself. So it would have been, so what happened, I've been meeting with the chief medical officers several times a week ever since in January. It's not a singular decision one way or the other. Collectively, we thought, okay, well, even though the precise assessment at that moment in time, in terms of just the cases we were seeing, was low, we need to shift that narrative. We need to shift what we think the risk is. So for sure, I, really look back and go, it can't possibly be low. We've got this trajectory looking forwards is escalating. And so that's the sort of timeline, if you like. Not to say that we minimize what the potential for this pandemic in Canada in terms of preparedness, but for sure, I think if we all look back, I think my brain's trying to shut out some of those moments, but none of us forgot. So there's somewhere in that early March timeframe we thought, this is not a containable thing. Cases are gonna come, and we must rapidly escalate our measures. So I think it was around that time frame. And no, it's not just provinces pressuring us or anything like that. It was a collective, discussion, really.
Dr. If I could just add to Dr. Tam's response. I would say that, it's not a single point in time in which, suddenly we say, the risk assessment say there's a risk to Canadians. I think right from the beginning, as Dr. Tam pointed out, she contacted the other chief medical officers of health. Meetings were starting already from sort of early January, and it has been regular ever since. And even for myself, I could say that since the first week in January, we were having regular bilat meetings with the CDC to also exchange information to compare our risk assessment notes in terms of what was happening both outside of North America and our respective countries, but also what the risk may be in terms of the risk to both Americans and Canadians. And so that work was always ongoing. It's not something that just happened at a single point in time. So I think that that's important to stress. And certainly I think some of the touchstones, I think, as Dr. Tam mentioned, with our good surveillance system here and close work with the provinces, territories, I think for me, there are 2 points that really signaled that the transmission was certainly getting, as they say, closer to Canada, and in the sense that we had a case reported, and obviously protecting confidentiality and so on, but there's a case reported in Canada in which the only travel, and this was a person coming back to Canada, was travel to Iran. And even Iran at that point in time had not reported any cases or any concern with COVID-19. So we, in many ways, with our surveillance system in Canada, picked it up first. We reported to the WHO in terms of good information exchange internationally, and that was a signal point. The other part also for ourselves was over time. Initially, the first few cases, as everyone can recall, were associated with travel coming from Wuhan, China. But as we've gone to later January, February, and so on, more and more cases reported in Canada were actually linked to travel from the United States. So that also showed us how interconnected we are, that the cases in Canada were linked to travel from the United States. And of course, in the United States, obviously with their connections to other parts of the world, shows how, the global sort of pandemic really sort of was advancing at a very rapid pace. So I think just to underscore what Dr. Tam said, it's not a singular point in terms of risk assessment at a certain date. It was something that was always an evolution since we were first alerted to it late December, early January. Thank you.
Thank you, Doctor. Catherine, question suivie?
Oui, absolument. So going back to Dr. Tam, if I understand correctly, the moment, one of the moments where you thought maybe the risk should change, so it's linked to that specific case in BC where we could see some community transmission, I guess, in Canada. And I just had another, so my follow-up is about the briefing, actually, today's briefing. On page 11, I was wondering, why was Quebec and Saskatchewan, for that matter, excluded from the analysis? And should we understand that the agency still has difficulty getting data from provinces?
So, obviously, the local level response is critical, and they need the data they need to respond to the particular situation. But I think it has, significant getting data local level up is a big impact on the public health system, which is pretty small. And so I think, things have improved over time. And just to sort of benchmark sort of data improvements, I think even in previous outbreaks or pandemics, up until fairly recent, I think with Zika virus, we were getting some case reports. In this pandemic, the province would try to give us things in individual cases instead of aggregate information. So that's sort of definitely a step forwards, but there is improvement over time. We had increased commitment to provide some of the indicators that we were looking for, such as occupation or race, and then to try and make it easier, we've now set up a national COVID-19 public health data portal. But yes, I mean, provinces have their own, I think, challenges in pulling the data also from local levels. So they needed to pull this up. There is not a specific issue with wanting to share. I think the system itself, meaning all levels, and going right down to hospitals, needed to be strengthened. And this is what we're trying to do during, but also I hope in going forwards, that we don't lose that capacity. And I think ministers probably have emphasized the injection of, I think is, if I can recall correct, $4.3 billion just to support data, lab testing, and contact tracing. And that's allowed us to also move into the development of a pan-Canadian health data strategy. So there are infrastructure and whether it's people or others that have to be supported all the way through the public health system. Just to get back onto page 11, just like we initially got our lab test developed really, really fast in Canada, getting genomics platforms stepped up in order to sequence the viruses has been a massive acceleration in the last weeks and months. So the genomics networks have been stood up. The screening now for mutations, if you knew which mutations we're looking for, the provinces are now screening a huge number of them. And so, I think it's not because the individual provinces are not prepared to give us that data. That data has to be standardized. There's reporting agreements as to, are we comparing apples to apples or apples to oranges? All that has to take place pretty fast. This is the best data we can provide at the national level, and it will improve. But it does give you, overall, a very good picture of the escalation and the replacement of the variants in Canada and in different areas. So maybe I'll leave it at that for now.
Thank you, Dr. Tam. Operator, next question.
Thank you. The next question is from Annie Bergeron-Oliver of CTV National News. Please go ahead.
Hi there. Thank you very much for taking my question. You're calling for more public health measures and restrictions. In Ontario, it seems like the restrictions ease, then cases go up, and then restrictions tighten again. Instead of this sort of yo-yo effect that we've been seeing for months, are you essentially saying that a more prolonged sort of stay-at-home order is necessary to get these variants under control? And can you just be more specific in exactly what type of stronger public health measures you're calling for?
Well, I think every province is different. You've seen how different the Atlantic to the territories to BC to Alberta, but all 6 provinces that are sort of west of the Atlantic are either experiencing or it's likely to experience a resurgence in the coming days and weeks. So, and some big provinces, Ontario, are taking a more regional approach. So there is definitely merit in that, but of course people do travel in between. So that has to be borne in mind. In areas where you have variants, where you have been doing this up and down sort of measure, I think it is a really important approach, perhaps to not go up and down too much, but sustain a certain level of measures. It may not be stay at home for every area. It's more you got to implement measures that work in your community where people are going to stick to as few interactions, as few times, shortest amount of time with the variants escalating. So if there are detections that this activity is ramping up, then definitely don't relax and try and keep that even keel until the vaccines have gained much more of acceleration in terms of coverage. And so, with the approach that Canada is taking overall, just trying to get that first dose into as many people as fast as possible, And with the doses now we're getting, it's possible to get that vaccine offered to everyone before the end of June. So with that in mind, you can think about that kind of time frame and maybe trying to keep a steady state where you're not going to suddenly get these resurgences until that kind of time frame where most people would have at least got one dose.
Thank you. Follow up?
Yes, as my follow-up, there are new reports out today that based on data of hospitalizations in Ontario, the variant increased the rate of death by 60% and may increase the hospitalization rate by 60%. I'm wondering what specific data do you have with regards to the mortality rate of the variant, and how well protected are the roughly 10% of Canadians who have a vaccine against these variants?
They're really excellent questions. I mean, prior to seeing what's happening in Ontario, we could only learn from Europe. And you've seen what happens in Europe and the countries where the variants take hold, both in terms of those epidemic acceleration, but also increasing data over time from the UK and others that the B117 variant, there was less data on the other two, but increases severity of the illness. And so Ontario's data substantiate, I think, what has been seen in Europe. We couldn't really tell until this point in time whether the context and the population immunity, etc., in Canada, how this is going to play out, and our public health measures, much of which is still in place. What does that mean when the variants introduced in the Canadian context? You're now seeing, I think, in much clearer ways in the Ontario context. They are the sort of leader in this area for producing that information for us. And so, yes, they are seeing that it is more transmissible. They've I think earlier on released their reproduction number, that RT number, for the variants versus not the variants. So for the variants, it's definitely over 1, somewhere between 1.2, 1.3, 100 people passing on to 120 others. Not a good scenario. And then they've now released the data that is showing, there's 60% increase in risk of hospitalizations, 100% increase in admission to ICUs, 60% increase in the risk of death. And these severity indicators can be seen across all age groups of the adult population. This is a very important set of information that should drive home to all of us why it's important to maintain these measures, and that even younger Canadians, the older Canadians, older people in Canada might be better protected. Just look at that incidence curve in the 80 plus and then the severity indicators. But the younger population, if you let those numbers go up, just by the sheer numbers alone, you're going to get some people who are going to end up in hospital. But given the B117 is more severe, you're going to get more younger age groups into hospitals and ICU. So escalating the vaccine to try and cover as many people as possible is a good strategy. And that's why I think NACI, the National Advisory Committee on Immunization, as well as the provinces, taking into account the likelihood of us having a resurgence, the vaccine amount that we have, and try to protect everyone, not just the individuals who are at risk, but the people who can give the virus to them. Vaccines are never 100% effective. You can protect yourself, but the other people around you need to be protected. For that, we protect each other approach to take hold, which is why, look at the United Kingdom. They haven't relaxed on 50% now of the population receiving one dose at least. So those are the kind of lessons that we have to learn. We didn't know how the vaccine was going to perform in real life. Now we're getting more and more information. So I think if you look at Ontario, then why would we think this would be different anywhere else in those other bigger provinces? As soon as those variants take hold, things could escalate. So ease anything and you have to be really thoughtful about it at this point in time. With the other aspect, with the higher risk populations, the vaccinations have gone quite well. We're hearing high uptakes in most areas of Canada, in the long-term care residents, and in they're beginning all the community-based, age-based approaches. So I think I hope that benefit that you've seen in some of those graphs continues. This is our first inkling of just how effective these vaccines are in Canada. And there is no way that if it's that effective in older population, that it wouldn't be really great for younger adults. And so we just got to keep going and as fast as we can with our vaccination while holding on to those measures, which is why, every time we hit a sort of a holiday period, we're always a bit anxious. Passover, Easter, Ramadan.